Hi everyone, I'd like to speak with you today about breast cancer cryoablation, pre and post, going over a case that we did. I'm Dr. Meghna Krishnan, American Board of Radiology certified breast and body imaging radiologist with over 12 years of experience, and at Scottsdale I have a practice called URPrecious 3D breast ultrasound, where we provide automated 3D breast ultrasound with AI, 2D breast and body ultrasound with color Doppler elastography, ultrasound guided aspirations, biopsies, second opinion reading, breast cancer cryoablation, and also REMS echolight ultrasound for bone density. Going over this particular case of cryoablation, so we had a 72-year-old female with a palpable lump in the upper outer right breast come to us. She's had previous left breast cancer with left lumpectomy about 15 years ago, and she had declined radiation at that time, and she has been on holistic naturopathic oncological treatment. So she declined mammography and came to us for the ultrasound, and here we can see that there is a hypoechoic suspicious mass. It's kind of irregular in shape, and it has angular margins, indistinct margins. It's non-parallel, somewhat taller than wide, and it has anechogenic rims. By size, it's about 2.5 by 1.4 centimeter by 1.9 centimeter with blood flow on color Doppler, and also on elastography, which is a way of checking how stiff the lesion is. Stiffer the lesion, more suspicious typically. We see it's a lot of red signal, meaning it's very suspicious. And so while scanning her in the lower axilla, we saw a second mass that measures about 1.4 by 1 by 1.4 centimeter, has blood flow. It could be a completely replaced lymph node with metastatic disease, or it could be a second primary. We recommended biopsying both the masses, which we did for her on the same day at our practice, and both the masses came back as invasive ductal carcinoma of no special type. It's the most common type of breast cancer. The second lesion, the lower axillary mass, they did mention that there were trace of lymph node tissue, so it was a metastatic lymph node. So she had estrogen receptor positive, progesterone receptor positive, HER2 negative. We got the breast MRI so that we can get better information of the extent of the masses. MRI could give us more information about the extent of disease. So looking at this mass, it's about 2.4 by 1.6 by 2.3 centimeter at 10 o'clock right breast. That's a palpable lump. The right lower axillary mass is also seen here on the MRI. It's 1.4 by 1.2 by 1.9 centimeter. Pretty much the sizes were matching the ultrasound measurements. Talking about treatment, she would be a good candidate for surgery too, but personally, by preference, she wanted cryoablation for multiple reasons. One is it's an in-office setup. It's not in the operating room, so the patients are more comfortable. There's no general anesthesia. We do it with lidocaine. Recovery is usually easier even because of no anesthesia, and even the scar-wise, it's just an entry site, small entry, like a biopsy entry, where we don't even put stitches. So it's very good tolerated. The one more important component, what many patients have been telling me recently, is patients actually love if they can have their native breast in place. I mean, they would rather not want to have parts of their body cut off every time just because that was the only way. This option of cryoablation gives them the opportunity to have the native breast in place, which emotionally also, I think it plays a very important role in a patient's journey towards recovery, in her next steps of looking forward and having a good emotional state rather than a sorrowful attitude. So we do in our office, how we do cryoablation, we use liquid nitrogen based device. It's by iSecure Medical ProSense cryoablation system. So here we see this unit, the liquid nitrogen is in this container, and there is a hose through which the liquid nitrogen would come out, and then this is the cryo probe. At the end of this is where we get the ice ball once it's in the tissues. And so here we see this is the 10 o'clock mass. The probe is through the mass, and we start the liquid nitrogen through that probe. And what we see here is the temperature of the probe drops quite dramatically within a minute, the probe is cooled minus 170 Celsius, and we keep that going on till the time of the freeze cycle. And then we do a thaw cycle where we stop the liquid nitrogen going in and we just let the body be as is, and then we freeze one more time through that same probe. All this is done so that we can deprive the tumor cells of blood supply, and also by freezing the intracellular and the extracellular water, we stop the machinery of the cells. And then when we thaw, that's a very important step too, where then the extracellular water floods into the cells and just opens up the membranes, and the cells are no longer viable to function as an entity anymore. So we cause necrosis in that area. To plan these cryoablation success for a patient, we have to look at the size. The studies have shown, based on the ice ball shape size, effectively tumors that are less than 2 centimeters are successfully treated through one cryo probe, through the freeze-thaw freeze at that time. So in our patient, the size of the main mass was 2.5 centimeter. So we did 2 ablation zones overlapping each other so that together we could get the entire mass, and 1 centimeter surrounding normal tissue also cryoablated successfully. Then we also had one zone for the right lower axillary mass, which was just about less than 2 centimeters. So here we see an ice ball of the 10 o'clock mass as we completed that freeze-thaw freeze cycle. At the end of the second freeze, we had a size of about 5.4 centimeter in the transverse, which is right to left direction. And then we also had a size of 4.7 centimeter in the craniocaudal or the head to toe direction. And then we moved on to the right axillary mass, and we cryoablated that with 5.1 centimeter by 3.5 centimeter. Came back then to the main, and we had about 5.4 centimeter by 4.9 centimeter. And then after that, patient was comfortable. In fact, even during the cryo procedure, we looked for the maintenance of the skin. This patient, the lesion was not close to the skin, but then also we monitor the skin, and we maybe inject some warm saline through a spinal needle below the skin so that the skin is safe. We might do a warm saline on the skin manually, just spraying over the skin, and massaging also with my gloved hand. So the patient at the end basically gets just steri-strips and a tegaderm, no sutures. Then the patients often go into something called the post-cryo inflammation, which is a way where the body now reacts or starts working to handle that procedure that we did there. And so the body works to remove the edema, the fluid, the inflammatory processes to start happening, which is a good thing because we have to remove the dead tumor cells. But also in that process, it is a possibility that patients could also benefit from the abscopal effect, which is a way where the immunity can recognize the dead DNA of the tumor and have it in its database, so that if for any reason it would see any tumor cell outside that cryo zone, then the body has an opportunity to maybe mount an attack on that cell by itself. Now, this has been shown in the mice in the lab, and also anecdotally there are some reports in the world. But of course, we do recommend that anything that would help this patient deal with this malignancy in a more comprehensive, total way, whether it's radiation, whether it's medications, anti-hormonal, and anti-HER2/neu, anything that is from the oncological point of view. Also, we recommend that patients consider and see a specialist for that. In this case, our patient came back for a 3-week follow-up, and here we see basically echogenic changes or bright changes, where this is called fat necrosis. And she clinically, her breast was no longer swollen at that time. She was pretty comfortable. She told us that the first day or two she did experience breast swelling and discomfort, and she couldn't lie down on that side, but subsequently she was able to go about pretty much routine. And so the recovery is really fast and quick, I believe, compared to surgery, which is one reason why patients seem to prefer this. So here we see, for instance, the initial tumor, if you remember, was like this, very dark and very discrete and highly suspicious on that. Whereas here now it's just bright and pretty much like just fat necrosis. Here we have the cryo bed or the zone where we see some blood flow at the outside periphery from the inflammation that is expected, but nothing within the expected location of the tumor itself. And here's a elastography picture where you see the colors are blue and light blue and maybe some yellow, and whereas before, if you remember, it was really red and very angry looking, very firm and hard, and it was now soft. Even clinically, the lump is soft and very pliable, and she was very comfortable, and it was really amazing. Here the right lower axillary post-cryo images where you see a lot of fat necrosis. This was the original mass that we went after, and we kind of vaguely see it here, but there's no blood flow in it, and also overall, that's called the tumor ghost. It's like a dead body, a body that has no life. So this tumor was just having a shape to it, but there was no activity of color Doppler. Even elastography was comfortable, and pretty much it was fat necrosis all around. Patient was very comfortable, and here we see during the cryoablation we did notice that the ice balls had blended even during the procedure. Because they were all too far from each other. And the same thing we saw, that the fat necrosis areas had kind of blended together between the right lower axilla and the 10 o'clock. So just to give you a flavor of pre and post again, here we see this 10 o'clock mass, and here's the right lower axillary lymph node that was completely having metastatic disease. And here now, post cryo, all we see are bright fat necrosis changes. Patient's lump wasn't anything conspicuous to her. She was very comfortable. It was soft, and she pretty much looked very pretty and happy and joyful, and it gave us such a joy to see her. So if you would like to reach out for any more information or even a cryoablation, then URPrecious 3D breast ultrasound is our phone number, our website, and look forward to more and more women benefiting from this and having a wonderful positive outcome. Thank you so much, and have a wonderful day. I wish you and your family very good health always. Thank you.